Go, 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 go. Thank you.
Wow.
Oh, Mo texted.
Out last night.
Tricuspid valve referral from A.
So this is a walk of shame, is it?
Oh. Does this look like shame? Don't ask, I won't lie.
Alex?
Huh? You wish.
Huh? Why would I wish? I mean, the guy's an absolute...
You know what? As a work colleague slash friend, you really are extraordinarily interested in my private life.
No.
No?
I don't get it, but that's the point.
Of
Breadsticks.
grissini,
Stale sticks of bread.
baked in Turin, delicious, light as air, perfect for dipping in an olive tapenade with parmigiano.
It's like eating old pencils. Hey, excuse me. We opened the box. We finished the box.
You said you don't like them.
Don't to the point doesn't mean I won't eat them.
Hi, Mo. Ciao, Matteo.
Ciao, Bella.
If you want to enjoy delicious breadsticks, you're going to have to lift your jaw off the floor, Mia Moore. Morning.
Sorry about that.
Hello there, Evil Knievel. There's me thinking it was just him that was going through the midlife crisis.
Hey, did I just see you on the roof?
No,
I so did. What were you doing?
I was screaming.
For any particular reason?
Sometimes I use scream therapy. Don't laugh. It's a release. It helps me focus.
I never had you down as a screamer.
Always.
What, I meant roller coasters and such like? Get your mind out of the gutter, Morgan.
Yeah, right.
There's an inappropriate work relationship waiting to happen. You don't think he's good enough for her?
No, it's not that. It's just that Morgan's got very particular tastes.
So did you once. Runs in the family. Irresistibility.
You confident enough to bet on it?
Somebody's been gargling the Christmas spirit.
For the Lord God omnipotent reign. So you looking forward to the Messiah?
I see myself as more of a visual artist, actually.
Since when?
Since I was. Look, I'll show you. Here.
What's this?
This is Dom's artistry.
There he is. He's had one too many Christmas carrots and... Oh no, look, he's doing a poo on the lawn.
Oh, your skills are wasted as a surgeon. Wasted.
Thanks. Well, once I get back from this ghastly course, I should have a few more masterpieces to show you.
Yes!
Well, thank you for your enthusiasm.
I meant this. I have just secured 2 much-in-demand tickets for the Comic Con convention. I'm taking Parker this weekend. Oh, and his mum is in for dialysis later.
Wow, you must really love that kid. Spent several hours in a convention centre with so many undiagnosed skin conditions.
Well, I've really enjoyed having him around. And not everybody wants to spend their life in tracky bottoms watching box sets and eating posh crisps.
I do. Oh, crisps. Sounds amazing.
Last Christmas, I gave you my heart, but the very next day, you gave it away.
No. You too, you see. You have rotted your souls with saccharine pop music.
Come on, the Messiah.
A work of pious genius.
It's not exactly Christmassy.
It's entirely all
Anyone
about.
at all interested in doing any work today? AAU, they're sending up
We're rehearsing, actually.
That was not a rehearsal, it was a warm-up.
The Messiah.
By hand.
suspected heart attack?
Ah, yes. Come to the right place.
Yeah, it's some sort of sportsman, I think.
Ah, collected by paramedics from the Holby Sports Arena.
A huge hairy rugby player with tree trunk legs.
Collapsed in the stadium during a sporting event.
Could be a basketball player, 7 foot tall, long, lithe.
Listen to them, Mr. Valentine. Tell me, when did gender equality become so unequal?
Well, Holby City is an equal opportunities employer.
I've been informed by British HR consultants that even to tell a co-worker how radiantly beautiful she looks today is wrong.
It is.
Ah, but women can now say they would like to ogle the thighs of a rugby player.
Looks like our hot athlete has arrived.
What the hell are you punks looking at?
Thanks for letting me know. Yep, okay, bye.
Right, listen up, people. I need all available nurses. Okay, keep that bay clear, please. We need to set up for an immediate blood transfusion.
Has there been an incident?
Maria, don't you worry. Bay 4 is clear. Now look, you don't need to talk if you don't feel up to it, all
I'm
right?
trying, don't fast. Does it really take 2 surgeons just to wheel my trolley?
Well, I'm not just a surgeon, I'm your nephew.
What happened?
I fainted.
I see. We're going to need to do an immediate blood transfusion.
Yeah, I'm on it. She's got to raise heart rate as well.
Okay. Well, the transfusion should make you feel better very soon.
Yeah, I know.
You know? What do you mean, you know?
Sasha, I think you should take a look at this.
What is it?
It's 4 transfusions in 5 months.
The neighbors will be terrified when they learn about my thirst for blood.
This isn't a laughing matter.
Sasha, everything is a laughing matter.
Well, we need to find the source of this bleeding. I suggest that we do a capsule endoscopy.
Yes.
That won't be necessary.
I know it sounds intimidating, but it's a perfectly straightforward procedure.
It just means swallowing a tiny camera.
Yes, I know what it means. I had one last week.
What?
Well, I'll chase the results.
Why didn't you talk to me?
Why bother you? It's not exactly the kind of photographs you frame over the mantelpiece.
So, your first day as Foundation Doctor Representative. You ready for it?
Absolutely. I prepared some reading materials, some worst-case scenarios, case studies, best practice.
Yeah, if I were you, I'd save the worst-case scenarios for later. And do keep the introductions low-key.
Low-key, absolutely, yeah. Attention, please. Can I have everybody's attention? Hi. I would like to welcome you all to AAU, the hub, the heart, the epicenter. Now, I know you've all left med school thinking that you know everything, but this is where the philosophizing ends and the real learning begins. So to mark this monumental day, I have a very special first patient for you. So if you'd like to follow me, come on.
Grudge match, huh?
Grudge ain't a big enough word for it.
Enrique the Embalmer versus Monty the Python.
My name should have come first.
So you're Monty.
The Python?
Don't pretend like you ain't heard of me, sonny. It ain't cool.
No, I actually haven't.
Promoter promised me Monty the Python versus Enrique the Embalmer. Grudge match of the millennium.
I see.
You're a wrestler.
Betcha, killer.
People die.
No, they're not real fights. They're staged. Like play acting.
You watch your mouth.
Sorry, you don't look like somebody who's just had a heart attack. Maybe it's about to happen.
Well, believe me, little missy, I know pain. And the pain that gripped my chest, it was excruciating.
Little Missy. So you from Texas or somewhere?
Somewhere. That certain sure am.
Yeah. I just see from your notes that your real name isn't Monty.
Oh, you think Enrique's really Enrique?
So you want us to call you?
Keith? You're not an American. You're from Basildon, Essex.
Well, you know, the career, the image, it takes certain embellishment, like, you know.
And there's Nag.
It's rubber. Health and safety, innit?
It seems that you have angiodysplasia. That's a vascular malformation of the gut, and that's what's causing the bleeding.
Now we know what it is. What are we going to do about it?
Well, that's your decision. We could take you into theatre today and perform a bowel resection. That's a relatively straightforward procedure. But, of course, as with any surgery, it does carry risks, especially in the more mature patient. Alternatively, we could continue with regular blood transfusions, and that will help to control the symptoms of anemia. I'll leave you two to talk it through.
Thank you.
Right, come on. Let's do a pros and cons list.
My decision, Mr. Griffin said.
I just said we should talk it through.
Tasha, I know you. You're going to tell me that surgery is too risky.
At your age, the chances of having a heart attack on the operating table are massively increased. And there is a chance you could have a colostomy bag or a stoma. There's post-op infection. There's pneumonia.
Oh,
I just want you to know that there are risks attached to this surgery, okay?
Sasha, it is not your body. I don't want to waste the last years of my life sitting through endless transfusions.
I'm here with you now. I can be with you. I can sit here with you. You know, we can chat. Don't laugh. It'll be fun, you know, a bit of auntie-nephew bonding time.
Once I rode a motorcycle 2,000 miles down Route 66. Huh? Now you tell me that blood transfusions will be fun. Sasha, please, leave my decisions to me.
Am I going mad, or is that an empty bed? What are you doing?
Oh, I've got abdominal pains, nausea, vomiting. There's blood in my stool.
Is this for real? You know there are actual patients we could be treating.
This is absolutely for real, Cameron. And you could start by telling me what tests we need to run.
Well, UNEs, FBCs, obviously.
Yes, and
ultrasound scan, possibly, and abdominal X-ray.
And what's your initial thoughts on my diagnosis?
Morven, I'm totally on board with this, but I've just remembered something I urgently need to follow up on.
Well, can't it wait?
Honestly, no.
Fine, but I want you back here as soon as possible. You're up.
Hey, I just thought I'd come and say hello.
How's Parker?
Oh, he's fine, brilliant. Eating me out of house and home. What is it with boys and cereal?
Kim. Hi. So how are you feeling?
Depends on what you're about to tell me.
Well, we have the results of your latest urine and blood samples, and your creatinine clearance has increased. In fact, all signs indicate that your kidneys are starting to regain function.
Which means we might be able to take you off the transplant list.
Oh, that's so good. Thank you so much.
We're going to have to continue with the dialysis, but if things carry on like this, then, yeah, everything's looking very positive.
Thank you. Oh, I can't wait to tell Parker. I can't tell you how good it would be to have him home again.
We'll leave you in peace.
I'm queuing for the bathroom at your gaff. You're going to miss him.
Yeah, good kid. And Maria liked him.
Maria?
Well, yeah, I did some shopping for her the other day, and Parker had some questions about a history project, and it was nice. Until she started to teach him poker.
Can you believe he can dance salsa and merengue?
Really?
So cool. I'd love to be able to dance salsa properly.
Are you going to zap me? Because if you're going to zap me, you've got to tell me when you're going to zap me, right?
No, this isn't...
I don't like electricity at all.
This is the opposite, Keith.
Oh, it's okay, you can call me Monty.
Right, well, we're just trying to measure your heart's electrical output.
It's not the just 180 thing they do on ER.
No, look. A normal heart has a certain electrical signature, so any abnormalities show up and show us what's going on in there.
If there's any cholesterol blocking an artery, if the chamber's been enlarged.
Or if you've had a heart attack.
And?
What do you think?
I think it looks fairly normal to me. Normal sinus rhythm, no SDT changes, no evidence of infarction or ischemia.
Surprised you've got time for that. Didn't think you had time to breathe on AAU.
Liz, I need the caffeine to keep me awake. Morven has got us diagnosing imaginary patients.
What do you mean imaginary?
Actually, it's worse than that. We're role-playing. A couple of weeks ago, I was diagnosing this woman that didn't realise she'd gone blind. A spot that even the great Bernie Wolfe missed. And now here I am diagnosing Morven the method actor's dicky tummy.
Well, you leave her alone. Morven might be a geek, but she is my geek, and I wouldn't have her any other way.
Yeah, I guess there is something endearing about it.
I've got a present for you. Comicraft convention. It should be you taking him.
Lucky me.
Well, it'll be worth it when you see the look on his face. Shall I put them in here?